Hi, I'm Dr. Samuel Sohn, a board-certified plastic surgeon in Las Vegas, and today we'll be talking about placement of the breast implant above or below the chest muscle. The placement of the implant underneath the muscle is often done in primary breast augmentation, individuals looking for breast augmentation for the first time. The reason being are severalfold. The number one reason that we place it underneath the muscle is that it helps to hide the implant. The implant itself can ripple and be visible through the skin, especially in the top portion of the chest, and by using the muscle as an additional coverage layer over that implant, it can help to hide that implant from view. The other reason why we place it underneath the muscle is because it reduces the risk of something called capsular contracture. Basically, anytime that we put an implant into the body recognizes that it's not part of you and it wants to create a rim of scar tissue or capsule around the implant. And that is totally normal. But sometimes what happens is that scar tissue thickens up and can cause breast distortion or breast pain at its worst manifestation. If that happens, then you may need to have a reoperation to remove that scar tissue. Underneath the muscle, it significantly reduces that risk of capsular contracture. The third reason that we often place that implant underneath the muscle for some individuals is that it does offer a little bit more upper pole fullness. There's a little bit more of a slope to the top part of the breast, and there's not as much of an abrupt transition between the chest and your breast itself. In certain individuals, we place that implant actually on top of the muscle. The reason for this can be severalfold. One reason would be that in certain individuals with a particular type of anatomy, if your nipples are a little bit low, for example, placement of the implant on top of the muscle can help to elevate the position of the nipple and lead to a little bit of a higher result without necessarily resorting to a breast lift at the same time. The downsides to placing it on top of the muscle are that you do have a little bit of a higher capsular contracture rate, typically on the order of somewhere between 2 to 4 times greater risk of developing the breast hardening that can occur with the scar tissue around the implant. There's also a little bit of a different look with the implants being a little bit lower. Some people call this a more quote-unquote natural look. However, I think they both can be very good looks, either placement of the implant above or below the muscle. We do a fair amount of implants both above and below, but most of my implants that I actually place are going to be below the chest muscle in a primary breast augmentation. Thank you very much for watching today, and I hope you continue to review the consultation process on breast augmentation. If you have further questions, please give our office a call for a formal appointment. Thank you.